And joining us for this week's Your Health segment is Dr. Rima Couzi, medical oncologist at the University of Maryland St. Joseph Medical Center's Cancer Institute. Doctor, thank you for being with us.
Thank you very much for having me here.
The number on cancer survivorship is really good news. It's 4.8% of the population. It's increasing. Why is that?
Yes, the current estimate of cancer survivors is about 15 million people, and the estimates for 2014 will be about 19 million. So that's great news. That means we're doing better. We're curing more patients. So that's related to early diagnosis and improvement in treatments.
You specialize in breast cancer. In terms of treatment, what do you have today that you didn't have maybe a decade ago?
Many things. We have new targeted therapies, for example, for HER2-positive breast cancers that were not available. Well, they were starting to. They're more mainstream now. We have improvements in hormonal therapy for estrogen receptor-positive breast cancers, improvements in early diagnosis, and improvements for treatments for patients who have advanced cancer, stage 4 disease.
On the early diagnosis front, maybe not everybody is rushing to get their mammograms or, in the case of men, PSA scores. What could you say that would encourage somebody to go do that?
Well, there's very much a direct link between early diagnosis and improvement in outcomes. So I would encourage everybody to discuss the screening guidelines with their physicians and to follow them. There's always a controversy about when you start mammography for women, and it changes between 40 and 45 and 50. But the earliest possible, and you have to factor in also family history and other risk factors.
When someone comes to you with a breast cancer diagnosis, how was it typically found? What first sent that person to the doctor?
Fortunately, most of the cancers that are diagnosed right now are diagnosed by mammography. So a big percentage of the breast cancers are stage 0 and stage 1. So that's good news because they are more curable than advanced stages.
So as the doctor, you'd prefer to see somebody who did not find it in a breast self-exam?
As a lump, somebody who hasn't been getting their mammograms and found a lump, ignored the lump, got bigger. Yes, the earlier it's found, the better.
I wonder if the good news about cure rates maybe makes people feel less incentive to go get the mammogram or do the testing and think, well, maybe, the medical community has this under control. I can wait a little bit.
I don't know. I mean, I think mostly people who don't do it, they're busy. They're busy with their children. They're busy with life. They're busy with jobs. And they just kind of put it off and think, I feel fine, And it's easy to put it on the back burner. And then you find yourself 2-3 years behind, I don't know that a lot of folks would say, oh, if they found it when it's advanced, I'll still have a good chance. I think it's more just, things get in the way.
Let me remind our viewers, if you have a question about breast cancer or cancer treatment in general, give us a call. We'll have the number up on the screen. You could also tweet your questions. The Twitter address is @MPT News. In terms of cancer broadly, the idea of being able to reduce one's risk, reduce one's exposure,
yes.
What comes to mind?
Oh, many things. Smoking, big one. Smoking is a major risk factor for lung cancer and many other cancers as well. So smoking cessation is key. It's also associated, obviously, with other health risks, heart disease, osteoporosis, many other things. So that's one thing. Alcohol intake, so alcohol in moderation or low level, because that's also associated with certain illnesses, liver disease, liver cancer. Obesity.
I was going to head there because that is associated with breast cancer.
Yes, and other cancers too, but there is definitely obesity is a risk factor for breast cancer. It's also associated with a worse prognosis at diagnosis, and there's actually some data that suggests also that weight loss after a diagnosis is associated with improvement in the outcomes. Although this has been validated in a large clinical trial, we're actually participating in it to look at women who are just in their survivorship phase. There are studies been looking at to see if weight loss help improve prognosis as well.
Let's take
post-diagnosis.
Good. We'll take a phone call from Baltimore County. This is Judy. Judy, thank you for the call. Go ahead.
My question is regarding mammograms. What are the advantages or disadvantages to a 3D mammogram versus a regular mammogram?
Very good. Thank you very much.
So a 3D mammogram improves the pickup rate. It's still, a standard mammogram is still very good, but a 3D mammogram allows the radiologist to manipulate the images, and they are able to pick up smaller lesions.
Should women be concerned about false positives?
Well, that's also an area of interest and or area of study. There is some concern that, especially in older women, that picking incidental small cancers may not impact on prognosis like survivor. But it's a bigger topic than I can address today because it's pretty complicated,
We're talking about.
But there's.
Please.
Sorry. You do mammograms, you find things, and you do biopsies, and sometimes the biopsies are negative, but you also sometimes pick up lesions that are real and lead to treatment.
In terms of ways to lower one's risk,
yes.
Don't smoke, don't be overweight. Does diet play a role, and does it play a role in breast cancer?
Yes, it does. Actually, the obesity has a stronger link with risk of cancer than the type of diet you're on. It doesn't mean you shouldn't eat healthy, but the information has been validated in studies with more weight, so obesity rather than actual type of diet. However, we do recommend that patients eat healthy, that they keep their diets rich in fruits and vegetables and low in saturated fats. Mediterranean diets have been well shown to decrease the risk of cancer. Diets that are keep the red meats low and heavy on plant-based food.
For those people making the 5-year milestone after a cancer diagnosis, you have a survivorship program at St. Joseph Medical Center. What is that? Well,
survivorship actually starts the day you're diagnosed. You're a cancer survivor from the moment you're diagnosed with cancer, because you're actually, that's a formal definition, because you are living with cancer or you're surviving it at that moment. However, when patients have completed their initial phase of treatment, they do have a formal visit where we go over the treatment summary, what they've received. We will go over side effects or symptoms they're still experiencing, and what can we do to help them move on, be it physical or emotional. We give them a summary of their treatment. We share it with the primary care physician, and then we kind of outline what it's going to look like over the next few years.
What is the emotional side of that?
Well, it's an emotionally related disease. It's the fear of cancer is the fear of how you're going to do. Are you going to survive it? How are your kids going to be? Your parents, your friends. What's life going to look like for you? So it is a big part of what we do. But it is very important to encourage patients to think of themselves as survivors, not as cancer patients. You don't want it to define you. You don't want to be a cancer patient. You want to be somebody who's had cancer and moved on to become a survivor.
Good place to leave it. Dr. Rima Couzi, medical oncologist with the University of Maryland, St. Joseph Medical Center's Cancer Institute. Doctor, thank you for the time.
Thank you for having me. Yeah.
We appreciate it. Thursday at this time on Your Money in Business, why attracting dynamic leaders from diverse backgrounds is good for companies and consumers. Join us for that Thursday at 7:30, and then Friday on MPT at 7:30. Join us for State Circle and the latest on Maryland politics. Thanks for watching Direct Connection, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.